Spain's perspective, Padre Toby, what's your reaction to this jobs document?
Well, we're very disappointed at the input of the document itself. It's a funds-free, target-free document. In reality, there's a chasm between the rhetoric of the government and what they're actually able to implement and what they're willing to implement. We have a situation where nearly 500,000 people are unemployed, 76,000 people emigrated last year, 1,600 businesses collapsed last year, and there's nothing to be done in relation to developing those businesses within this document. What we're seeing is like a lot of previous government issues repackaged. And if you mine down to it, issues like microfinance, for example, there's 500 million euros made available through Europe last March for the development of microfinance. And yes, this state is one of the few states in the European Union that hasn't drawn down this funds. The government have announced microfinance 4 times, and yet again they've repackaged it. And what needs to happen, it needs to be implemented as soon as possible. The government missed major opportunities here. There cannot be any growth in jobs without some level of growth in demand, and we won't see any growth in demand as a result of this. Also, there are major cost base affecting small businesses. We have a situation where upward-only rents. Ireland has 100% higher rents than the European average, and yet the upward-only rent infrastructure remains in place, making a lot of retailers in the state uncompetitive. 72% of the Irish population work in the small to medium-sized enterprise sector, and many of these people will be actually looking at this and seeing where any support exists for them.
Pat Doherty, a significant amount of money has just been announced today for the development of the A5. It's been a long time coming. What are your feelings today?
Well, I think this is absolutely brilliant, and it has to be very much welcomed. A commitment of 583 million into the economy, vast bulk of it going west of the Ban, particularly to the northwest in terms of the A5, the hospital in Altringalvin, the hospital in Omagh. All of this is good, and it proves to people on the ground that politics can work when you apply yourself. And I think also it puts it up very much to the Irish government that they signed up to an agreement that was part of the peace process, part of the St Andrews Agreement, and they should reflect on bringing in the balance of their contribution at an early stage.
Well, first of all, on behalf of all deputies and senators here in the Houses of the Oireachtas, I want to welcome the representatives of Rett Syndrome Association of Ireland. It's very important in this month, the last day of which is International Rare Diseases Day, the 29th of February, that we concentrate our attention on the needs of rare diseases in Ireland, what people, what families, what communities are coping with, and oftentimes not the priority focus of government or the Department of Health or the Health Services Executive. Rare diseases by their very nature are oftentimes regarded by the system as the poor relation because they don't have the volume of weight in terms of lobbying for their respective needs. And so it is today that the representatives of Rett Syndrome Association of Ireland are here to inform members of the Houses of the Oireachtas of what they as family members, as parents, are coping with in relation to Rett Syndrome. And we're delighted to have the opportunity, members of the Health Committee who will be joining me in this welcome here for a briefing meeting at 12 noon. And I'd like to introduce Andrew Keogh, who is the Chairperson of Rett Syndrome Association of Ireland, and Andrew might like to pay a few words just to this.
We're here today representing approximately 60 families who we have on a register who have children with Rett syndrome, which is a rare neurological disorder which has profound and multiple implications on their abilities. We're also here to highlight the fact that on top of raising these children with these multiple disabilities, the difficulties that we have in accessing services and help to enable us to help these children. That is the purpose of the visit today.
Thank you, Andrew. And thank you very much to the members of the press for turning up this morning.
This morning, Taoiseach, I received a copy of the Dublin North East Regional Service Plan. Now, the HSE has asked that this be kept confidential, and no wonder it makes grim reading. And I think I have a a duty to make it public. Is the Taoiseach aware that for the third year the budget for this region will be reduced, this time by a further 120 million? Are you aware that this plan expects up to 400 staff to have retired by the end of this month, plus a cut of a further 561 staff jobs? Are you aware that it's planned to cut 205 long-term beds in our older people's services and the 2 nursing homes, both in the constituency which I'm honoured to represent? St Joe's and RD and Cottage Hospital in Drogheda are being considered for closure, and right across all the services, from mental health to older people to hospital services in the North East region, which is also the region which has seen the largest increase in population since 2006, that this will see one cut heaped upon another, and that this will be replicated across the other regions. So, Taoiseach, do you agree that this depth of cuts to our health services is totally unsustainable?
This protest was organised this morning for Leinster House for the Drogheda Save Our Cottage Hospital Action Group. We're here to highlight the fact that this current government are putting our public healthcare provision for our elderly at risk. They're attempting to close not only the Cottage Hospital in Drogheda but also the St Joseph's public nursing home in RD. There's several busloads from Drogheda and RD expected here today outside Leinster House. Both groups have organised meetings with the Minister for Health and our 5 local TDs. Thus far, our local TDs from government haven't given a total commitment that they will pursue the retention of the Cottage Hospital and St Joseph's, and we're here to up the ante basically today and to seek their wholehearted support for the retention of the Cottage Hospital in Drogheda and indeed St Joseph's in RD.
Well, today was an opportunity for the action group to save St Joseph Hospital in RD to bring their concerns to Leinster House. I thought today was a very useful exercise, and it was great to see people, patients in their 90s, coming up to vent their views in this building here behind me, and particularly I was delighted from the RD perspective that we had all our facts and figures ready, and Claire Keane, who was designated to make the presentation, done a very good job on that. So I think it was a very useful exercise.
Between 2010 and 2012, $2.25 billion.
Sorry, deputies. Please.
$2.25 billion has been taken out of the health services by your government and by the previous Fianna Fáil government. Yet in the last 3 months, you have handed over $2.5 billion to bondholders.
Thank you.
Look at the 2 figures. 2.25 from the health services, 2.5 to bondholders. And next month, $3.1 billion in a promissory note will be paid to Anglo.
Please,
so Taoiseach, this is about choices. You're making the wrong choices, and there's no escaping the social and health consequences of your government strategy in this, not least in terms of patient safety.
Inside the Dáil, the children and the parents from Gaelscoil Bharra and Cabra are here. We're waiting now nearly 17 years for a permanent school building, and the parents and the kids are saying to the government today, we're not second-class citizens. You promised us a permanent school building, and by God you better deliver it. Call will our school, the kids are shouting. Let's hear the answer from government and make sure we get our permanent school.
Gaelscoil Bharra was founded in 1996, and despite having met 2 Taoiseach and 2 Ministers of Education over the last 16 years, we still have no sign of a school. Our file disappeared for 5 years. We met the Department of Education last August, and they promised they would get back to us within a number of weeks with a commitment to build a school, but still no sign of it. We're now in our 16th winter in our school in prefabs, and people talk about old people spending a couple of days in a hospital corridor. Our children spend 8 years in prefabs. It's absolutely scandalous. And we're not going to stop protesting until we get the school built.
Thank you, Deputy MacDonald, to reply, please.
Tánaiste, you know, dodging answering questions with that kind of inaccurate waffle that you delivered at the beginning of your response is really very unedifying for you. Can I also say it's a bit ironic.
Sorry, the deputy is entitled to reply.
That the man who lectures on respectability comes from an outfit that was very close to North Korea and was quite adept at running off dodgy fivers. So remember your own past too, Taoiseach, if you might. You haven't answered the question as to
could I have
why...
some order, please, to the deputy? Could I have some order, please?
You haven't answered the question as to why Minister Phil Hogan refuses to meet with these residents. You say that your priority is and that there is an urgency around making these homes safe, and I agree with you, but there's no signal of urgency on the part of your government. And could I say to you, Taoiseach, that it contrasts very starkly with the urgency with which you moved a statutory instrument to award over 17,000 extra euro to the Minister for Housing for the glory of her attending cabinet meetings, which is part of her job
Question, Deputy, over time. Thank you.